What I'm focusing on today are kids birth to 3 who are in the child welfare system, who have come out of a birth family and been placed in foster care, and then some of them have moved on to adoptive homes. Some of them will be returned to their birth parents' care. But one of the reasons why I want to do this training is to really focus on how very young children experience the world differently, given their developmental capabilities, and what that means for how they experience these various parts of the child welfare system, and what it means then for those of us that care about those kids. So I want to be clear that when I talk about these young children, there's a range of ages, there's a range of backgrounds, and so I'll be talking generally, but each kid has their own unique journey. So each child starts out hardwired neurologically to want to attach, to have a loving connection with a caregiver. And the reason that that's there is life or death. In our evolutionary environment, young, 6-month-old would make a really tasty, organic, high-fat dessert for the predators that were around there. And to have our species survive, it was really crucial that parents and young children up through their growing up are really well connected, where parents are tracking what's happening to their kids, and kids are tracking, where is that person who's in charge of me? Where is that person who's going to keep me safe? So when I talk, part of what I'll be talking about is stuff that's hard to hear and hard to hold in mind, because it's hard to think about young children going through really hard stuff, not just abuse and neglect in their birth home, but how they experience a transition into a removal from that home, transition into foster care, moves between foster homes, and eventually a move perhaps into an adoptive home or back to their birth family, or maybe eventually emancipation. So I want you to know that it's okay to listen to me closely. It's also okay sometimes to take a break, to look at handouts, to fuzz out a little bit if it gets too intense. Because some of the things that I talk about may bring up feelings, both because of your own histories, whether any of you have been foster kids. Certainly in this size, some of you have experienced abuse or neglect in your childhoods. So just so you know, feel free to do that. Feel free to take a break and leave the room if you need to. I think it's really important that people take care of themselves when they're hearing difficult information. There's also in a half-day training a lot of stuff I can't talk about. And so I like to put out that caveat that I'm not going to try to talk about the cultural differences between infants and toddlers, which exist and are really important and need to be talked about, but I'm just going to try to give that birth to 3 viewpoint, which is, in a way, is its own culture. Was there a question? No, okay. There's also a lot going on between a 3-month-old, a 9-month-old, an 18-month-old, a 26-month-old, and I will try to talk a little bit about all those differences, but we could be here for a week with a day on each of those sort of time periods. So I'm going to be forced to sort of talk about it in a little more global way and not get into all the different ways that it's affected from a 3-month-old who's very oriented around the physiological needs, and it's just beginning to develop communication and being able to signal certain pieces of their needs, to someone who's 26 months old and has, 20, 30 words perhaps, signs. So there's a lot of variation there. And finally, in this population, there are a lot of nervous system issues that kids have, either because just from the genetic contribution or because of prenatal exposure, because of malnutrition, because of PTSD effects on their nervous system. There's a lot going on neurologically that affects what I'll be talking about. And again, I'm going to talk generally about kids who have a relatively intact nervous system, recognizing that a lot of kids have neurological variations that may impact what I'm talking about. So there's some basic issues in trying to think about the way that infants and toddlers look at the world versus the way older kids and we adults do. That time, these kids live in the present. They're not thinking about, they can't put into place sort of a memory where that happened in the past. It's clear that infants and toddlers have memory. It's not the same as our memory. It's not narrative memory around stories and, oh yeah, we went to the movie last night and we saw the new Planet of the Apes movie and it was this and it was that. And, for them, a memory might be, oh yeah, I saw this guy in a white coat and it hurt. Because when you look at kids who, after they get an immunization from somebody in a white coat, and you show them a picture or another person in a white coat a week later, their heart rate changes a little. And it's clear that they have some level of body memory, that visual of that person is connected to something that was a little stressful. So there is memory there, but it's different kind of memory than we have. It's more visual, it's more a particular photograph or episode rather than a narrative. And they don't place it in time versus, was that a day ago? Was that a week ago? Was that a month ago? So they have memory. It's much more about what's happened to their body, and it's not a narrative kind of memory. They orient to the world differently. One of the things that's the most important is just, where is my attachment figure? Can I see them? Can I smell them? Can I hear them? And when I can't, is there a second person that I've grown to sort of trust available as a stand-in? That might be the other parent, that might be a grandparent, that might be a child care provider. But do I have somebody that's familiar? If I've got nobody, I'm getting anxious. I'm getting scared because I do not feel safe. And neurologically, it's wired that this is life or death kind of unsafe. So they get stressed really quickly unless they've been trained that there is nobody, which I'll talk about somewhat later in neglected kids, where they may not have developed an attachment, and that has its own whole sets of pieces. Communication is happening from birth. They get communication from us. Now, it's not verbal language communication, but they have a sense of our mood, positive, negative, how oriented we are to them. Are we tracking what's going on with them? And they are sending us communications. There's research on how parents interpret different cries. And that as you get to know your kid, a hunger cry from a wet diaper cry from a, oh crap, I'm really in pain and come right away kind of cry. So that communication is happening, but it's it's not about language and meaning so much as specific signals that are getting sent back and forth. A lot around emotion and around basic needs and whether they're attended to Um, babies learn there's a certain thing when you're saying, yeah, I'm getting the bottle ready, but it's not ready now, hold on. And they start to be able to know, even though they don't know any of the words, that communication means, yeah, you got the signal, I'm hungry, and it's coming. And they start to be able to wait as they understand that signal. The coping skills that babies, toddlers have are much more primitive than what we have. Not surprisingly, I don't think that's news to anybody, but it's very basic in terms of if they're seeing something that's disturbing, they can shift their gaze away. If something is too intrusive, they can sort of go blank, they can dissociate. Some babies in very stressful situations just fall asleep, not because they're tired, but it's a way of escaping the stressful situation. I thought about trying to give you all a sense of what it's like to be a young child, especially in the child welfare system. And so if you could imagine for a second, this isn't a very fun fantasy here, but if you could imagine you leave the training and you're in a car accident, and it's unfortunately a really pretty bad car accident. And after the car accident, you're in a wheelchair. So you can move around some, but you can't nearly get to where you want to get, and you can't get out of your house by yourself. You need somebody to help you. And unfortunately, you've had some brain damage. You have something called aphasia, which means you may be able to think, but you can't really form language. So all of a sudden, you can't communicate to adults. You can't even create like a note you could write. You can grunt, you can scream, you can signal, but you're really limited. And your primary arm, whether you're right-handed or left-handed, but your dominant arm has been damaged, so you can't really get stuff. You just have your non-dominant arm, which is sort of clumsy. And so you can't feed yourself, not very well. You try to do it, I'm right, and it's sort of hit and miss. You need a ton of help. And let's say you have two caregivers, one sort of in the morning and one sort of in the afternoon or the evening. And one of them really gets you. They get what you need. They anticipate. They sort of like, okay, you just did some feeding and now you've dribbled and they gave you some stuff you could pick up and eat, a piece of toast, but you're sort of a mess. You don't want to be a mess. So they automatically are sort of cleaning you up. They're checking out whether you need a new shirt, a new top, as opposed to a caregiver in the afternoon. When you spit or you dribble, they hit you on the back of the head because you made a mess. Now, you can't tell them to stop doing that. You can't even prevent them from doing it. You can't get out of the wheelchair to do that. You can't get away from them. You're stuck. Most of the time, for infants and toddlers, being stuck is a good thing. They're stuck with people that love them. And that's great. It feels like that stuckness is a plus. It's attachment. But when you're stuck with a caregiver that you can't do anything about, that feels abusive, neglectful, that is really hard. Now, imagine for a minute that you're in that wheelchair and neither caregiver shows up. And in fact, you've been moved to a rehab facility and you don't know who your caregiver is going to be. You've got to somehow sort of get them to know you again. I'm doing foster care, obviously. But, it's a whole different thing when you can't tell them very clearly what you need. That level of powerlessness is sort of the air that babies breathe. And when they feel like they're in a caregiving environment that's responsive and attentive, that powerlessness is not really an issue. They just sort of relax and assume that they'll be well held, well cared for. And that's great, because then they can do all the development they need to be doing. But when they don't have that sense of being held, most of the time, as if you were in that chair and you knew that you were going to get hit sometimes and you didn't always know when, you'd be watching that caregiver pretty darn closely. You'd become hypervigilant because your safety demands it. So, questions about that, and I used to be a university professor a few lifetimes ago, and I can talk this whole 3 hours. I can do a whole day training and talk the whole time, and I don't think either one of us wants that. So I welcome questions. I will try to manage if I need to sort of get back to the material. I'll be in charge of that, but please, if you have questions and you're willing to have your voice on the tape, raise your hand. I'd be happy to have this be interactive. So I hope you'll be brave. Yes?
So the one very basic understanding of communication and body language, I know that you said that you're not focusing on the cultural piece.
Mm-hmm.
And even with placements where the child, every adoption or placement is a trans-cultural placement, right?
Yeah.
And so when I think about that, one family being very loud versus another family being very quiet.
Yes.
And how those needs may or may not get met. And I'm wondering if you'll be talking at all about that as well.
I'll be talking some about, the question was, will I talk about sort of how between different placements, each placement is sort of its own culture. And there can be differences just in terms of loud versus soft, really active families versus families that are more slow going. And just to add, then how that fits or doesn't fit with the kid's own temperament. So I'll be talking a little bit about that when I talk about the movement between placements, but it's a great point. Okay. So when little kids experience neglect, neglect is, sort of that air that you breathe. It's the kind of maltreatment which is day in and day out. When they have a need, they don't expect necessarily that it's going to be met. Now, some neglectful homes have, the parents are meeting certain needs but not others. And kids will learn that. Yeah, I'll get fed. If I'm hungry, I can, they can expect that they might get fed. However, other families, food is not consistent. So kids will learn where their needs might get listened to and where they will consistently not get listened to. And so the kids will either I just won't I'll stop paying attention to that need. I won't expect it. I won't even try to feel it. If I want hugs and hugs are never available, well, I'll just sort of stop wanting hugs, stop expecting it. They can get it themselves. Oh, I was just going to talk about this 13-month-old who, when first in a foster home, always wanted to crawl under the dining room table. And they didn't quite get that, but they heard they were having a visit with the kid's biological grandparents, and they heard that the kids would not get fed much, and after they would get taken down from their high chair after some amount of feeding, they would tend to crawl around the floor and look for food that they had dropped because they were still hungry. So kids will find ways to try to meet the needs themselves. Or they'll scream. And some of that scream is not really a communication that they expect to get met, but it may be, my diaper's not been changed in 2 days, and I've got raw sores on my bottom, and I'm in pain. And so I'm screaming for that reason. So it's that level of distress can come out of neglect, where they just are distressed and their nervous system is all aroused and they're dealing with stress hormones, but they're in distress. So they take in a general sense that I'm not special. So at a core level, kids in loving homes get a sense, when their parents look at them, they're the most special person in the universe. When you've got a good, secure attachment, that kid knows that the parent is just so tuned in. And that's a great thing. I mean, it's a beautiful thing to watch. But when that's not there, that's very sad. And there's some of the, if you will, the sparkle that goes out of the kid. Because nobody is looking at them with any kind of a sparkle. So I'm not a sparkly kid. Other kids are competitors. In a neglectful environment, any kind of affection, sometimes food, material resources, toys, all of that may be in scarce supply. The kids that I saw, I've seen a number of preschoolers who tried to kill their younger siblings. I think I'm up to 5. And in every single case, there was severe neglect. And it was clear that the addition of the baby was seen as a threat to resources. I remember way back early in my career, this was the late 80s, I saw a 22-month-old who had put together enough planning that when mom went out into the hallway, he pushed the door closed behind her. She was talking to a neighbor in her apartment building. She couldn't get back in. Right after the door closed, he ran over to the 2-month-old's crib, climbed in, and started biting the 2-month-old. Mom called 911 right away when she heard the kid screaming. When she got locked out, she got the fire department there in about 5 minutes to get her in. But the kid still had, I don't know, dozens of bites. The baby was not long-term injured by any of that. The 22-month-old can't really do that. But I've had 3-year-olds hold pillows over babies' faces. When little kids are trying to survive and they take on, I need to do it myself, some of the time that means getting competition out of the way. And it can just mean like pushing a kid down so you can get to the food. It doesn't always have to be so extreme as murder. But it's a serious thing in terms of trying to have an attachment relationship with your siblings and develop loving relationships, and not just sibling competition is normal, but this is at a whole nother level. So the good stuff's always scarce. Hoarding is really common. We see it in lots of neglected kids. You can see it in really little kids, and it's basically, I have so little. Don't let any of it get away. Whether it's something that's really useful or not. It's just, if it's mine, if I believe it's mine, whether it is or not, just hold on to it, be aggressive, defend it, because you've got so little. It's really, kids are hardwired to start out with a desire to be loved, but there's a dilemma with that feeling when it's not reciprocated, is that it's painful. It really is hard. There's a famous study called the still face experiment. Probably some of you have seen it. It's just a regular mom playing with her 6-month-old. It was filmed by a guy named Ed Tronick. And the mom is instructed to just have a blank face for like a minute. So not to be smiling, not to be reacting, just a blank face. For just a relatively short period of time, with a kid who's got a good attachment. No other stressors necessarily. And just a minute of the mom sort of looking at the baby, but just having this stone face. And babies fall apart. I mean, initially they try to get really cute. And like when you're, oh, mommy, mommy, and they get really cute. And they're trying to take care of it themselves. And if that doesn't work, if mom doesn't come back, then within 30 seconds usually, or at most a minute, they're crying and screaming and drooling and just in pieces, because that's so important. That sense of you're tuned into me for safety, but also out of this desire to be loved. And so if it's not there, it's intolerable to keep consciously trying for it. And so they stop expecting to be loved. Now, it doesn't mean in a new environment that they won't try again, but depending how long it goes, how many environments they're in where they don't feel it, you get to places where you get kids who, really the reactive attachment disorder sorts of stuff start kicking in, where it's really hard for them to believe, and to start hoping seems way too painful. So it's a real dilemma for them. And for little kids, it's also, you tend to see a decrease in exploration, in curiosity, because why? A lot of little kids, when they explore and they've got a healthy relationship, they find something new and they're, oh, cool. One of the first things they do is show it to mom. Because mom's response is part of the motivation to be curious. Yes, there's some hardwiring to learn, which is really good for our species, but it's also about to share that learning. And without that shared learning, the motivation to explore is not eliminated, but it's diminished. And it tends to be exploration around stuff that I need. Where is their food? Where are their toys? How do I stay warm? It's oriented around that sort of problem solving for what I need. And so it's not a open, be curious about the whole world. It's more a curiosity that gets more task focused. Questions?
I have a question about
Yeah.
that sparkle in a young child, say a 11-month-old who was in the same foster home from birth and now is being taken back and forth from the foster home to a relative, back and forth. So I've seen the sparkle go out of that baby's eyes.
Mm-hmm.
So is that a long-term, I mean, this has continued for about 6 months and not resolved yet. Is the long-term effect permanent?
So the question is, and I'll be repeating the questions even if you all can hear them, just so they're on the tape also. The question is, if a sparkle goes out of a kid because of whatever kinds of things that are going on, is that permanent? And I'd say that no, the sparkle can come back, and obviously it varies from kid to kid what the situations have been, but oftentimes the sparkle can come back, but it doesn't mean that the kid's the same as they were before. That there's oftentimes a sort of a vulnerability that even though they can get really engaged with a new family and with really reliable caregiving that, is consistent and goes forward through a period where the kid doesn't have the sparkle and there's still all that effort made, it can come back, but there is a vulnerability. I see it, for instance, in kids that, I think about little kids I've seen, 1-year-old, 2-year-old, who have a parent die. And then they're older, they don't have any memory, and there may be a step-parent that comes in or not, but they have a vulnerability, and you see their reactions to loss. That, they may have a great attachment to the step-parent that comes in, or to a foster parent, or to an adoptive parent, but there is still that sort of sense of, crap happens. And I know that in my body. And even when stuff's really good, if something goes sideways, my reaction's not going to be the same as if that was the first time something ever went sideways. I know that things can go sideways in ways that feel really big to me. And so relationally, they can do it and get the sparkle back, but it doesn't mean that it's all the same. So physical abuse, and here I'm talking not about a one-time hit, but where there's been a pattern of physical abuse. First is automatic, grown-ups will hit me again. There is not a question. It's too important to little kids that if there's been a pattern that they've seen, they believe it will continue. And it takes quite a while of no hitting for them to start to have a question about, will I be hit? So that's really important, because little kids, they are hardwired to sort of figure out how relationships work. That is their primary developmental task. There's some other ones, but that's so huge to figure out, okay, this is the time in my life, those first 3 years, where I'm going to figure out what are the patterns in relationships. How do they work? How do I get people to know what I need? How do I communicate that? How do I get it back? Do I need to do cute? Do I do cute with the dimples? Do I do cute with the laugh? They figure out tons of stuff about how relationships work. And if hitting is part of relationships, they will learn that. Now, it doesn't mean that it's, like we were talking just, that they'll expect that forever, but that will always be a possibility. Right now, they start out with, I know it's going to happen. And then if there's a long enough period where it doesn't happen, well, maybe it's not going to happen with this person. I can trust them. But I'm still, and it's just that, always that sense of, it is something that's been there. And so there is a non-zero probability that it could happen again. Certainly kids know I don't get hit every single moment. And I don't like hitting. So part of that figuring out how relationships work is, when am I going to hit? When am I not? Even if there's really not much they could predict, they will attempt to predict it. They'll look for mood. They'll look for behavior. They'll look for anything they can do. So it means they're really hypervigilant. And it means they're taking the stance towards the abuser of not somebody that is just somebody that I love, because they oftentimes still love the physical abuser, but also somebody that's a threat. So love and threat go together. And if you're little and that's just what you know, it's not like that's a weird thing. That is just the way the world works. It's not the exception. We sort of think of it now, we know broadly enough in the world that most people don't hit other people they love. We do know it happens. But for a little kid, when that's their primary caregiver, that becomes sort of the default. This is the way the world works. And that's part of what's different. You know, if there was an abuse and physical abuse started when a kid was 6 or 8, they have that sense of, at the beginning, that wasn't there. And then it becomes more of an exception. It may be you're stuck with the person that is the exception, but when it's little, when you're little, it becomes, this is the default. And it's one of the crucial differences when abuse and neglect are happening at birth to 3, is they're creating their default model for how the world works, how relationships work. Little kids are learning about, well, who's powerful and how are they powerful? And in healthy families, that's, you know, people who are really loving and people who take care of stuff and people who say that something's going to happen and then it happens. Those are all powerful people. And in a physically abusive home, the person who's the abuser tends to look powerful. And so, yeah, I want to be powerful, so I'll hit. Doesn't take much to figure that out. I won't hit the powerful person because they're bigger than me and I'll get hit. But pets, younger sibs, maybe even parents that won't hit back. So it's not that they want to be abusers. They just don't, they want to feel powerful. They're not trying to be exactly an abuser. They're not trying to necessarily do everything that the abuser's trying to do. But frankly, when you're in the same home, it's easy to think of a young child who's aggressive and violent as just like their stepdad or the dad or whoever was, or the mom who was the physical abuser. And really little kids can't do much to get away. All they can do is do something with their consciousness. If they can't even crawl yet, how do you get away from being hit or being shaken? Basically, they fuzz out, they dissociate. Because then it's less anxiety provoking. It's a way to sort of go away from reality because they don't have much option beyond that. And that's quite problematic because it can start to be something that if they expect to get hit a lot, they're fuzzed out a lot. And when they're fuzzed out, they're not learning, they're not being curious, they're not taking advantage of opportunities. So there might be a 5-year-old sibling who is trying to be nice to his baby brother and who actually wants to smile and feel some self-esteem from being a big brother. But baby is too fuzzed out to take advantage of one of the few people in the environment who might actually be a positive connection. So kids miss out when they're fuzzed out. It has a lot of other secondary consequences because engagement with the world is a basic way that you can get positive stuff, whether it's learning or relationship, and the fuzzing just gets in the way of all that. And of course, a lot of them stay under the radar. They learn how not to get seen, where to hide, how not to ask for things, even from a non-abusive parent, if that abusive parent is present, because that can trigger. Questions?
Are there ever instances when paddling or spanking would be appropriate for kids?
So the question is, are there ever situations where paddling or spanking is appropriate for kids? I think there's a lot of variation in non-abusive parenting. I feel like most of the vast majority of the time, you can get across a message without the use of a physical. I mean, there are times, like a little kid's running out in the street. You really want them to get that that is not okay. But I still would say, and some parents use a spank in that situation as a way of like really getting the kid's attention. I don't think that's necessarily harmful, but I think there is just so much physical violence in the media and in our society that I would recommend not using a physical method like that. Not that it's necessarily that particular instance is going to by itself be damaging. I don't think one instance of that is, but I think it's a slippery slope, and I think the clearest boundary is using your voice, using other methods to really get it through to the kid, your message that you're trying to get through with the spank. So that's my opinion. Yes?
I completely share your opinion with that. I don't know what it is like when you're fostering or adopting a child that grew up in an environment where they've become desensitized to the usual methods.
Yeah.
When you have an attachment, you have that voice, the kids can go, oh,
Yeah,
okay.
the mom voice. Uh-huh.
But if they haven't had that, then I can see where the parent would be at a loss, because how do you get the child's attention when they have invested so much in not feeling stuff?
Right.
So I don't know if there's answers to that.
Well, those are some of the tougher cases. She's bringing up the question, she agrees around not using physical means, but some kids, when they're into a foster or adoptive home, because the pre-existing home, the attachment may not have been there, and so you don't have the relational leverage that you usually have, and that's a huge dilemma, because that relational leverage is what buys you so much. So part of it is trying to create the relational leverage, and in the meantime doing a lot of prevention to like have, try to set it up so that they can't it's just physically impossible for them to get to the material. Or there's a kid I saw who loved to get any kind of bottle, and whatever was in the bottle got dumped out or squeezed out. Shampoo, dishwasher liquid, and it all went on the floor. And it never was quite clear sort of where that behavior came from. But that's one of the easier ones this kid was also a climber, but it became sort of, how do we secure liquids all through the home? And the older kids had to know, you can't leave your soda out, you can't, it became a huge deal. But the parallel track is you work to be building an attachment so that you can start to have that relational leverage so the kid has some motivation. But those are some of the most difficult situations. And certainly there are, there may be things that the kids want, whether it's TV or a particular toy or if they don't have an attachment, it doesn't tend to be things like the lap or whatever, but you can use some of the things that they actually want to try to, at a basic level, have rewards and consequences. But a lot of the kids who come from that environment, they're very resistant to rewards and consequences because they recognize that it's the other person's agenda, and they don't want to go there. So sometimes that works, but it is a huge dilemma. I think it's building the relationship and sort of surviving until you get there with the best that you can do. Yes?
Hi, I work for DHS Child Welfare, and
Yes.
So even something that would be seen as non-abusive in the
Right.
regular population,
Mm-hmm.
children who have been through the tragedy of abuse and neglect are not allowed to be spanked
Mhm.
or paddled
Mhm.
at all. So that's just something that's
Yeah.
a bottom
And that,
line.
thank you. I should have mentioned that if it's a kid who's a foster or adoptive kid, that DHS rules are there's no spanking, no paddling, no physical discipline, and that's so. Thank you for that. Okay. And then, really unpleasant to think about, but sexual abuse does happen to infants and toddlers. And so one of the things that happens is that touching or that contact is often seen by the little kid as something that feels very special, meaningful to the adult, that the adult is, if you will, marking or identifying that as, even without words, but in how they act, as a special connection, special time. That's not meaning to say that the kid sees it as positive, but they recognize that the adult feels different to them during that time. And that the adult's body may seem different, the adult's voice may change, the facial expressions on the adult may change. And so there is this marking of this is different than the rest of interactions. And there's something going on here. So even though infants and toddlers don't have a cognitive capacity to put it into context, at a basic sort of visual relational level, they can recognize that something different is happening than what usually happened. So that's at a basic level. When a sex offender is sexually abusing an infant or toddler, they are not thinking about the welfare of the infant or toddler, pretty obviously. The infant or toddler doesn't really exist as a person. They are an object. They are being thought about, fantasized about, in a way that is not connected with the second-to-second, minute-to-minute reality of what's going on for that infant or toddler. And the infant or toddler feels that there is a disconnect. There's both this time that is special, marked, but during that, my connection to that adult is weird. They're not tuned into me. They're doing something on the inside in their head. I mean, little kids aren't being able to think this, but their experience is that the adult is not really present with them in a relational sense. It is, they're doing something, but it's not, because little kids are really great at tracking when someone's connected. And it doesn't have to, I mean, you can be just, you're holding a young child and you just got a call that somebody you love is really sick and is in the hospital. And you're thinking about that person. You're in your head thinking very appropriate sort of thoughts, but you're not tuned in for 30 seconds while you're sort of in your head about what's going on with my friend who's in the hospital. And the little kid will pick up on that. And oftentimes you'll see some way, like with the flat face experiment, where they'll try to get you back. That may happen during the sexual abuse. The little kid may try to get the adult to sort of tune into them in a real way rather than in a sexual fantasy sort of way. But it won't work usually. The touch may feel pleasurable in the sense, not in a contextualized sort of adult sexual way, but just in a sort of physiological way, that there may be stroking that feels like, oh, that feels okay just in terms of sort of the basic sensation of the touch. There may be genital fondling or whatever that may produce a pleasant sensation, if you will. But it's also confusing because of what I've been talking about before. There is this sense of, oh, this touch is sort of, okay, that's sort of nice, but you're totally not trying to connect to me in a positive way. It's a very weird disjunction for little kids to make sense out of. You know, older kids have had enough exposure to media where they sort of get at a very basic way the context of what's going on. That has its own problems. For them to realize what's going on and to be thinking of it, that introduces its own weirdnesses. But for little kids, a big part of the weirdness is there's this contact with certain physical sensations, but it's so cut off from the usual kind of contact that I have with other people. Even physical abuse is less confusing than sexual abuse. Physical abuse, the other person, you know, you may not know what caused it, but the other person's affect is congruent with what they're doing. They're mad, they're hitting me, and they're reacting to what I'm doing, whether I'm, you know, trying to crawl away or cowering or screaming. Their voice and all their behaviors are in sync with what I'm doing. It's pretty darn unpleasant, but there is a sense of being in sync. With sexual abuse, that sense of being in sync is not there. So it's a very weird kind of interaction. A lot of sexual abuse of infants or toddlers happens when they're naked. And so later on, being naked can feel like this is getting recreated. So it's a signal, whether it's a diaper change, a bath. Kids can have reactions based on the fact that they've gotten naked. It can just be going out to the pool in the backyard in the nice summer days. And they've gotten the idea that certain parts of their body are different than the rest. It may be their genitals, it may be other parts of their body, it may be their mouth. There also are certain particular unpleasant parts of sexual abuse that may occur. Just when babies are forced to do oral sex, that's when it gets more traumatic. There can be choking sensations, other sorts of things that are really make the sexual abuse sort of more traumatic than, more physically aversive is probably a better way to put it, than the fondling. Certainly also, although it tends to happen much more rarely than with older kids, penetration, those sorts of things also become physically aversive, traumatic. It becomes a mix of sexual and physical abuse. So, questions? Yes?
So you're talking about adults who are abusing children.
Adults or kids?
I was going to ask, so what's the difference between a child, a sibling, sexually abusing a sibling versus the primary caregiver?
So the question is, what is the difference if a sibling, another child, sexually abuses an infant or toddler versus a caregiver? It's fairly nuanced. There's some aspects that it's not different. There's still that weirdness, that disconnect, because even when a child is sort of doing sexualized play, and it's part of their own working through, being affected by their own sex abuse history, when they're doing sexualized play, they're also in their head, and they're not as connected with their younger sibling as they usually would be. Siblings tend to do different kinds of sexual acts on average than adults. So there doesn't tend to be as much physical trauma. And the relationship is different. And so some of the confusion is different. Siblings are more often seen as play partners. Siblings also can be tormentors because these kids may also have been physically abused. And so the sibling may, the sexual abuse, it depends a lot on the context of the sibling relationship. But sibling relationships in general are different than a parent-child relationship. And so that affects how the infant or toddler will interpret it. Okay. And just so you know, we'll do about 15 more minutes and then we'll take a 10-minute break. So this is more about general maltreatment rather than a specific form of abuse. But that my thoughts and feelings aren't known in all these kinds of abuse and neglect. My internal reality is not known. And by the age of about 9 months, kids are starting to think about your mind and my mind at very basic levels. I mean, when a kid points to something to say they want it, that indicates that they know you have a mind. Because they know that you got the message, that it isn't, usually pointing starts by the kid trying to get it, and the parent sees it and they go get it, and the kid learns, oh, by pointing, you get the idea that I want it at a basic level. And that usually is coming in 9 to 11 months, depending on neurological issues. It can get delayed, but and within autistic spectrum, that pointing as a form of communication can change also. But generally, kids are starting to have a very basic sense of another mind out there at like 9 to 11 months. There's some arguments for it to be younger, but it's pretty clear it's there by 9 to 11 months. Feelings are painful, don't have them. They're not worth it. So let's be numb. Because the positive feelings, they're just not around often enough to make it worth it for all the negative feelings. So let's just get away from the feelings. I am bad. All the feedback I'm getting, or the majority of the feedback I'm getting, is that I'm not valuable, I'm a pain, I'm not somebody to be thought about, so that translates to I'm bad. But I want to hide that. I don't want to think about it. It feels bad to me. I want to hide it from myself, and I want to hide it from others because that tends to be a trigger for not getting something or getting something I don't want. If I do nothing in response to the bad stuff, so I get hit, if I don't cry, if I try not to have a feeling, you get pretty close to sort of almost I hardly even exist. I don't have needs because my needs aren't going to get met. There's a lot of ways that general personality development is impaired when infants and toddlers are in these environments, because why really develop a complex sense of self? Nobody seems to give a crap. Now, it doesn't mean that they don't still have goals and desires. It tends to be around survival rather than sort of, who am I? Have to keep myself safe because nobody else will. And sort of that basic birth to 3 assumption of this has happened or have I expected it to happen every day of my life. So even when there's days when there's no abuse, the kids still expected it. So therefore they thought about it. It was as if it happened. And so the sense then becomes they don't have a sense of a future where things could be different. They just have a sense of this is now and it's always going to be now. So usually I feel bad for my audience at this point, because I've said a lot of just really crappy stuff and asked you to imagine yourself being in that place, and just lots of ways that little kids are getting a crummy deal. And now I'm going to pile on and add more, because that's the experience for infants and toddlers. I'm sorry, but now after this, they get removed. And we all know that there may be lots of times when that removal makes great sense. But removal is still often a trauma. There are exceptions to that, which are really good. I'll give you a little hopeful piece, just that there are times when kids are removed from their birth parents and they get to go to a relative, a grandparent, an aunt or uncle that they know well, that isn't a stranger. They've been in their home often. They may have been cared for or lived there before, where that transition is really pretty smooth. And that's wonderful. That is so nice for those kids to have, even though they get to get out of the abusive, neglectful environment, hopefully to a relative who is healthier than the birth parent or parents, and can really do a great job of being a foster parent or maybe eventually an adoptive parent. And so that's fantastic. In those situations, the removal is probably the least traumatic it can be. It's important to think about the actual specific events of the removal as a specific trauma, because it can vary. It can be really bad. It can be police breaking down a door. There can be gunfire. There can be people dying when they raid a drug house and there happens to be a baby there. Police may not have even known the little child was there. And so that's probably the opposite extreme, and that doesn't happen very often. But it's useful to know as a future caregiver, if it's possible, whether that particular event was traumatic, because that doesn't tend to get into the court documents, because it's not needed for the legal system to figure out whether the parent's rights are going to be kept with the birth parent or removed, but that can be a trauma. Sometimes it's more in between, where a caseworker and a police officer show up at a home, parents are there, there's some crying, there's some distress on the part of the adults, two strangers that the kid doesn't know, they take the kid from the home, maybe with siblings at that time, so they at least are with siblings that they know, but it's still, I'm not sure I'd call that traumatic, but it's pretty darn stressful. And depending on the age of the kid and how it happens, it can be really stressful. Sometimes, again, if you have a relative, if they've already been screened, sometimes I've seen situations where the relative is called and the caseworker's there and the kid actually gets handed off to the relative at the birth home. That's more rare. But so remembering that removal, there's various transitions that kids go through in the child welfare system. Some of them there's preparation for, some of them there's not. That first one, there's no prep. I mean, it's very rare for that. So yes, question.
So what would be the difference in, like, for the infant, I'm speaking specifically of infants,
Mm-hmm.
when they're exposed to drugs in utero, so that means they get taken at the hospital from the birth mom, so they never have lived with the birth mom, and they go straight from the hospital to a foster home.
So I would say here that opinions, professional opinions, are divided. It's clear that even, like, I think the research was 15 minutes after birth. They looked at how infants respond to the smell of their own mother's milk versus another lactating mother's milk. And infants know the difference in the smell. It's also clear that they know the difference of the mother's voice versus another female voice. They've been hearing it in utero. It sounds somewhat different when you're out, but they still recognize it, and they will suck more to hear a tape of their mom's voice than another woman's voice. So there's already some degree of familiarity with the birth mother, even at, right after birth. It's clearly, I think, much less than even a month or two later. So there is a division of opinion about whether that familiarity is enough to create a marked sense of loss, that sort of vulnerability that I talked about. I don't believe so. I think there's a difference that gets noted, but I think when kids are removed in the hospital within a day or two of birth, that loss is, that difference that they notice doesn't rise to the level of loss. Now, I would say very clearly, there are other people in the attachment field who would disagree with me about that. So I want to be clear that it's not like that's a universally held opinion. And I don't think research has happened that's really answers the argument. I think we're both talking sort of theoretically, trying to extrapolate from what we know, what are newborns going through. It's clear that, when newborns are removed from their birth mom, like they have to be in that, they have some reactions physiologically to that. But what we're really talking about is in those cases, there's repeated removals, but so my opinion is that it's not traumatic. Kids would notice that difference, but I don't think it becomes a loss that creates a vulnerability. Yes?
And like Giles and Keisha pointed out, there's also there'd be additional physiological struggles which are going to impact the kid. It'd be almost impossible to tease it out because there's the withdrawal from the substance. NICU time is always kind of, I call it a micro trauma for the sensory system. So yeah, to tease out which is which would be very hard. I mean, because have to be going through stuff.
Yeah, definitely. Okay. Oh, just for the people watching at home, that last comment was that in addition, it would be hard to tease out always in looking at sort of that stuff, the other factors going on like prenatal exposure and so neurological differences. And those kids are often in the NICU, the neonatal intensive care unit, and that has its own stressful components. So there's a lot to sort out there. So I talked about that survey that I'm doing with infants and toddlers. So among those kids, I've got 83 surveys so far. Those kids have averaged 2.5 placements before adoption. Changes in foster placement contribute to the child making sense out of the world. It's the world isn't, and relationships aren't a stable thing, that they change. Unfortunately, changes between foster homes, they've gotten more planful than they used to be, and there's some more effort to make that a planful transition, but there's still less planning in what I see, less planning in those transitions than in the transition to an adoptive home. There's more often not much warning and not reverse visits and not sort of that stuff. So it's, again, it's a loss of home, friends, siblings, neighborhood, caregivers, that culture of that previous foster home and what it means going to the next home. And the young child tries to make sense out of it. How come it happened? Obviously, there's all sorts of factors that lead to children changing a placement. It can be to reunite with a sibling. It can be for a range of reasons. It can be something about the initial foster parent that's totally separate. That foster parent has cancer and needs to lighten their load, or they're moving, or there can be all sorts of things, but it starts to become a sense for the kid of, oh, this is the way the world works. You're with somebody, and then you're not. And that's just the way things are. And we know that those are exceptions. That's very different from the experience of the vast majority of kids. But with an N of 1, that each child is making their own scientific study of the world. And if they've been in a birth home and then 2 other placements, by the time they're 2.5, it can start to feel like, oh, this is what happens. I think ideally, and I would think there's been a wonderful focus on trying to reduce the number of placements, because I think everybody recognizes that just having more placements is definitely not helpful, and it's actually damaging. I think we all know that. It's just there's still, so I'm not trying to sort of criticize the system for the placements, because I believe the system is trying to minimize that. But it's still something that the child experiences and contributes to that sense of the world being a place where things change. Yes?
So next week I'm involved in transitioning a 14-month-old and a 27-month-old into an adopted home. They've been in one foster placement since birth.
Uh-huh.
And at committee the other day, foster parents were there, and they said they knew they wouldn't be able to see the kids for 3 months after placement. I'm not sure who told me that. What's your feeling about that contact after the adopted placement? Do you think that it'd be better for them to see the foster parents right away, or I don't know why they have a 3-month thing in their mind, but they can't. I mean, obviously they think that's better for attachment, that the kids would have time to attach to the adopted parents. But what's your feeling about that? These are like grandparents.
Uh-huh. So the question is, she's going to be facilitating a transition from a foster to adoptive home, and there's a general expectation that for 3 months after the placement in the adoptive home, there won't be any contact with the prior foster parents. And what do I think about that? And I think that's one of the things that I collect data on. Both, are there reverse visits, and how soon do they happen? And where does the first in-person visit happen? Does it happen in the new adoptive home? Does it happen in the prior foster home? Does it happen in a restaurant or a park? So that's part of the data I'm gathering. The belief behind having a blackout period where there isn't contact with the prior foster parents is that it helps the child focus on the new relationship, the new attachment figures, and to deal with the fact that they're not going to be, not to confuse them, that if they see the prior caregiver, the child may think that they're going back with that caregiver. I believe that there's also a rationale to do visits sooner, because when children see, young children especially, see that their prior caregiver is validating, admiring, honoring, especially when it happens in that adoptive home, I'm a proponent of those visits happening in the adoptive home if they're going to happen, not in the foster home, because I think that can be confusing. But it's my belief, but that's part of the reason why I'm collecting data, is to have some data to back up my belief, because right now this is just a belief and it's not on data, is that when prior caregivers endorse, if you will, the new caregiver, that's a wonderful message. Both that relationships can not be sort of like one relationship stops here and the next one starts here, but that there's overlap, and that this caregiver that they really trust is saying, yeah, I laugh and I smile and I talk and I eat together with this new caregiver. It's a wonderful bridging to me for that. So just, I think there are people who believe that the blackout period does lead to better attachment with adoptive parents. And I think it would be wonderful to have more data, because obviously in a survey I'm not able to assess attachment, to really look at sort of what our practices are and how does that look at sort of the attachment relationships that we're really interested in having as our goal, to have some practical things where we do some different practices and look at outcome. But that's down the line a ways. So why don't we take a break? And I still have a lot I'd love to tell you, so how about 10 minutes? Kids coming to an adoptive home, and one of the interesting pieces, and I tried to indicate this a little bit by the size, is that adoptive parents come to this relationship with their new child with a lot of feelings, because the process of adoption starts before there's matching. The process starts in the adoptive parents as they're trying to make their decisions about whether to adopt or not, where to adopt from, what that means about their own families, what that means whether they've had infertility issues, whether there's loss there, whether they were adopted themselves as kids, and what that means if they're doing it then. My daughter who's adopted is now 23, and she's thinking about, do I want to adopt? Do I want to have birth kids? She's considering that more because she's adopted. She is more aware of that as an option that she might want to pursue. But, adoptive parents are already been in this process, if you will, for at least months, if not a lot of times years, before they're actually at the point of getting to meet the child that's going to come into their home. And that's pretty darn huge. And there's lots of feelings. But the child is just like, yeah, another person, another adult. And all these feelings can be, on the part of the adoptive parent, can be sort of like, what is that? You just like, ugh, so full of loving you want to give me, and hugs and smooches, and you want to stare at me all the time. And, it's natural, it's a great thing, but it's part, for little kids, part of what can be sort of disconcerting. Older kids may have some context for it, and there's a basic sort of thing, a question of safety. Are you safe? Because they know there have been people that aren't safe. So yes, who are these new people? So the first thing I wanted to talk about is just within an attachment framework, there's levels of safety of people. And at a basic level, the most basic level of safety is that you're not going to hurt me in the next 5 seconds. That I'm safe with you right now. And frankly, that's fairly easy for the kids to establish. And we don't always have it. Sometimes if we're get out of a car and somebody runs up to us and they're screaming about something, At that moment, we may not know if they're safe to not hurt us in that moment. Once we start to hear, they're hearing that there's a fire and that they need to call 911, do you have a phone? All of a sudden, probably their level of safety changes. We understand, okay, yes, they're all worked up and all that because there's a risk to property and life and they need to get help. And that's why they're so, woo. It's not because they're high on methamphetamine or something and they're going to attack us. So there's that very basic level of safety right in the moment that kids don't always feel when they've had physical abuse, for instance. That's been part of their experience and that they expect. The next level is safety that when there's other people around, you won't hurt me. So I'm in my foster home, I've got my foster parent in the same room, and you come to meet me, and okay, you're not going to hit me right away, and I start to figure out, okay, I feel safe, I've got my safe person with me, there's other people around, you're not going to hurt me. You seem like you pay attention to what goes on with other adults. Next level of safety is other people aren't around. So for instance, I go with you for a first, this visit, and one of the questions I ask on the survey is, on what visit did the child go with the adoptive parents without the foster parent around? So like going out for a burger at McDonald's for 30 minutes out of the foster home. Well, that is public, but there's periods there where probably other people aren't around on the way there or whatever. So am I safe with you without anybody else watching? That's another level of safety. And then there's safety even if I'm crying or if I want something, which the little kid can see is provoking. So it's sort of, do they feel safe asking for stuff? Do they feel safe being mad? Some kids coming into an adoptive home, there's that honeymoon. They don't feel safe with you if they're provocative. And that safety gets established in those first few weeks, hopefully not months, and they start to be provocative. And you're like, oh, great. But it is meaning they see you as more safe. And then there's a different kind of safety of, will you keep me safe? Not just from yourself. You're safe. Now, will you keep me safe? If I signal you, if I cry, if I do it, will you come? So there's that level of safety of, I'm signaling you and you're responsive. And then, even better, is I have trust that you will keep me safe even when I'm not aware of a danger. I don't have to let you know that I need safety. I trust you to do that. That can take a long time. Yes, question.
So I've had my foster son for 2.5 years.
Uh-huh.
We're moving forward slowly but surely towards adoption.
Uh-huh.
And there's been, several points throughout our time together where he'll have behaviors,
Uh-huh.
And the question is always, well, is it because of this, very young trauma, or is it because he's 3?
Mm-hmm.
And I guess my question is it even important to try and tease out? Should I even try? Is there any way to know?
I will get to some of that later. Just a basic question of, in trying to sort out behavior, whether it's trauma-related, past experience-related versus just normal developmental behavioral issues. I think it is useful to tease out because I think there can be different responses you want to do if it's a trauma-connected behavior than if it's just 3-year-old testing the limits. I think there are some things that are the same, but I think there are things that are different.
Okay, thank you.
And then the best level of safety is the kid's just totally relaxed. And they can be curious. They don't have to be vigilant. They trust you to totally take care of stuff. Now, there's lots of kids who come from the child welfare system who never get there. That's okay. They can have a happy, healthy life without getting there. It'd be nice if they got there. I would root for that. But they've had the experiences they've had. It's part of them. And the fact that they never fully come to the place of, yeah, the world's basically a safe place. And yeah, I know there's some dangers, but I trust my parents now that I'm 10, that they basically got it pretty well covered, except the things I need to know about stranger danger and et cetera. But there'll be lots of kids that they've been in your home for years and years and years, and they don't get to that fully relaxed, totally letting you have the job of keeping them safe. I mean, at some point developmentally, it's not supposed to be totally your job anymore. You're supposed to be partnering with that. But so it's useful just to think about when you're looking at the kids, sort of where they at, and they go back on this. So they may get to a certain level of safety, and then crap happens, and they feel less safe, and they got to work forward again and build some more trust. So unfortunately, it's not like once you get to a level, you never go back. If that was true, it'd be so much easier. So the child comes to the adoptive home, the adoptive relationship with questions. Really, really crucial questions for them to answer. And they will have a lot of focus on this. The first one I just dealt with, which is, how safe are you? Basic question the child's trying to answer from the very second they meet you. And if they're old, when they're older and can anticipate meeting you, they're thinking about that from whenever the idea of an adoptive family comes into their mind. So the next question is, when do they leave you? Not if, but when. Not always true, but it's a question for a lot of kids who've had moves. They want to figure out what your patterns are. And what that means is sort of, when do you get upset? When do you hit? When do you have the food? What do you do when I hit my knee and it's bleeding? What do you do? I mean, all the basic sorts of things. That, growing up in a birth home, kids know all that because they've learned it just through millions of experiences that they're doing it. But they don't know that with you. But they know it's going to be different. And it can be things like, the other family, kids would just come and eat whenever, and there was no real mealtime. This family, nope, you've got to wait to eat till we get everybody together. There's going to be a family mealtime, and the grown-up's going to be there, and somehow they think that's really important, and it's going to happen. But that means you've got to deal with many people's agendas around food, which is different. And so there's all sorts of situations like that. What bedtime is like, what getting woken up is like, What do they do if they wake up in the middle of the night? Can they call out? If they call out, what's going to happen? Will people hear? Will people not hear? What if I need to go to the bathroom? Can I get up in the middle of the night? You know, most of them are still in diapers, but some 3-year-olds are toilet trained. They may regress in the new home, but so it's because part of figuring out those patterns leads to the next question of, what do I do to get what I need? What are my strategies? They have strategies. We might call them manipulation, but basically they're just strategies for survival. And it's, how do I get food? If I want hugs, how do I get those? If I need help getting a toy, if another kid hits me, you know, how do I get what I need? And part of that is based on what are your patterns. And it could be they assume, well, I'm not going to get anything from you. I didn't get anything from previous caregivers, so I'm not going to get anything from you. How do I hold on to what I have? And a lot of times they may not have much. There's a study I did a while back when I was at the Morrison Center. We were looking at kids new into foster care. And one of the things I did in that study was ask whether their transitional object, their special blankie or teddy bear came with them or not, and looked at how the kids were doing with their behaviors. And kids that had their special object with them had less problematic behaviors. They made a good transition. Now, some birth parents don't want to let that go with them because they're worried it's going to get lost. And in their mind, the kid's going to be back home soon. So I'll just hold on to it, and then that's sort of where their objects, because some of those objects are really special. It's one of the few things they have that feels stable. People may not be stable, but their blankie may be stable. And so those objects can be really important. And so another kid comes and grabs their blankie. That's not just, oh, what was mine got grabbed away. That's like life or death. Or if you just want to wash it because they threw up on it and they don't want to let it go. Another question is, have you spotted their badness? Some kids assume right away you know they're bad. They have a sense that their badness is so evident, everybody knows it. There's no point in trying to hide it. I'm just bad. And they, I wouldn't say revel in it, but their behavior indicates that, you know, they identify themselves as bad. A lot of kids initially in that honeymoon, you know, want to hide it. They have this sense of, it will go better. It may not mean you're going to love me, but at least it'll go better if I hide it. Now, inevitably, they can't. And we actually don't want them to, even though it's a little convenient in the beginning. But they need to know that who they are can be valued with all of their accompanying stuff. That's the best thing that can happen. But they will be watching you for, like, can you do it? I see lots of it with kids I see in therapy where they don't want parents telling me stuff they did during the week. They want me to be the person that doesn't know about the bad stuff. And they're really upset when their foster parent or adoptive parent tells me about bad stuff they've done because they didn't want me to know that. And I say, I know you do crap like that. It's not a big deal. Okay, we can talk about it. But I want them to have a sense, a crucial message is just, yeah, all your crap, yep, still like you. So related to the badness is, well, okay, let's say they actually really fall apart. They have a tantrum. Happens with kids birth to 3. What are you going to do when I fall apart? Do you leave me? Do you leave the room? Do you try to comfort me? How do you try to comfort me? Do you try to discipline me? What do you do? Because the tantrum can be easy things like they're just on the floor kicking and screaming. It could be they're pounding on a window and they're going to hurt themselves if they break it. You know, there's times when there's interventions that have to be done because there's safety issues, either for themselves or for another kid. At times, you can just be present with them and try to help them, but they will be trying to understand, and there will be times where you're getting triggered by their tantrum because they just broke stuff that's really important to you that wasn't high enough or whatever. So what will you do if I fall apart becomes a really important question because they know that that's sort of them at their baddest, if you will. And what does that look like? And then at a basic question is with the adoptive parents is you have your patterns, you have your routines, you have those behaviors, you have your reactions, all those other things. But then there's your feelings. What is up with your feelings? Adoptive parents feel different than foster parents. And foster parents who become foster adoptive, there's a place where you're sort of shifting in how you are towards the kid. Those kids know it. They feel that. And it's a really important thing. There's a wonderful book by, I think his name is Waterston. It's about the creation of a birth mother, foster mother, adoptive mother. She's a stepmother. She's been all these sorts of different mother roles, and she talks about her experience internally, emotionally, in those different roles, and how it feels different being an adoptive mother than when a foster mother and being a birth mother. And it's a really interesting book. But the kids get that, but the adoptive parent feeling is different than what they felt from their birth parents who were maltreating. There might have been love there, but it's a different thing. It's hard to describe. We don't have great words in English. I'm not sure if there's a language that has them, but we could use a lot more words for love than just love. But an adoptive parent's love when you've been waiting and waiting to be able to do this, when it's a whole different ball of wax, and the kids feel that, and so they're trying to understand what is going on with you. You feel different, and it's sort of nice, sort of overwhelming, sort of intrusive, and what the heck am I supposed to do with that? Depending on the age of the kid, it can just send them into tears, into a tantrum. Just your positive, loving feelings that you are sort of gushing, leaking out. Not that, I'm not saying you should necessarily stop, but just to know that it's quite a deal. So obviously a steep learning curve. This is my daughter when she was about 3. And I sort of did photoshopping, but I had those piles on my desk. She wasn't actually looking between them, but I created that. But so you as the adoptive parent want to form an attachment. You so want to be emotionally connected to that kid. That is not their primary agenda. It may be in an agenda down the line, but in the beginning, their agenda is, I want to feel safe and I want to figure out what's going on. And so a lot of times, that's a mismatch. And it's really important in all that sort of loving feeling you have to be trying to be able to be sort of in the kid's head, understanding that they're just like are you going to hit me? Are you going to dump me back at the old home? What's going on here? And it's much more of a getting oriented. And that makes sense a lot of times for foster parents, that new kids are getting oriented. And that makes sense to them, and they clue them in, and they show them routines. And adoptive parents often have some sense of that, but all those other feelings sometimes get in the way of remembering that this kid is still just getting oriented to safety and what's going on. I had a longer training. I hadn't realized I'd done another slide in there for another break, but in 3 hours, only one break, sorry. So before I get started with this, let me just pause for a minute for questions about that basic sort of thing about the kids when they first are coming in the home.
I know every kid is going to be different, but what do you think a process, because the parents want to be so attached, but not coming across so overwhelming to the kid knowing that that's what they need?
Mm-hmm.
What do you think a time frame is? I mean, it's going to be varied upon each child's experience, but.
So a time frame when they'll be sort of more ready to attach.
Right.
So the question is about the sort of kids are going to need to get oriented. So when are they ready for attachment? And I would say, a little bit from the beginning, but I think in the first week or two, there's a lot of just getting oriented. And part of that getting oriented, though, they'll still be learning about you. And part of that learning about you is you're predictable, you're warm, you're safe. Those are the building blocks of attachment. So in that sense, it's happening from the beginning, but it's not, they won't necessarily show attachment behaviors towards you right away. They might. If they do from day one, it's actually sort of a little concerning because that may be a survival strategy rather than an actual attachment. But the building blocks about attachment are happening from word one. But them being able to actually really letting it sink in and ready to use you. They may be ready to be held, but that's more about, I'm just so stressed out, I need some soothing, and you're offering it and I'll take it. That's not the same as attachment. That's sort of like a port in a storm. And that's part of them observing how you do that leads to attachment. But in the beginning, that's just, I am so freaked out, I could use being held. So I'd say it's going to be a process that will take years, but with kids who don't have reactive attachment disorder, who are coming in with some availability for attachment, that you'll start to see that process happening in the first few weeks. But it's really variable. There's another hand, yes.
I just wanted to say, I'm an adoptive parent and I went through that. I would say listen, watch, adapt, and respond. When you have a kid coming in there, like you said, every child is different. You have to adapt to what they're doing. Watch, see what they're ready for. I didn't do any of that, but that's
Yeah. Mm-hmm. Yeah. It's a great point that, to be very watchful and to really trying to tune in. And I'll be echoing a lot of your points later on. So all behavior is communication. It all has meaning to it. And our job is trying to figure out that meaning. However, it's often not very clear what the message is because the child's fear, and sometimes the grown-up's fear or overwhelming, can garble that communication. So, here we got the little kid, let's say this is a 3-year-old saying stupid mommy to the adoptive parent, which feels really crummy, you're all ready for this good stuff and this is the first thing you get. What's the real message and what is the question that the child's asking with that behavior? So, kids have lots of fears that can garble the message. Some of them we've talked about before. One of the ones that we haven't touched on, the exploding and destroying everything. That kids can have a fear about their own anger and rage and their tantrums. That will cause them to get removed, cause you to just disappear, the home to disappear. In essence, that they can just, little kids believe that they can just, when they have a tantrum, everything's gone. And they don't really know that it's still going to be there when they are done. They have some sense of that, but in the middle of the feelings, it's hard to hold on to it. It's also about whether they have a fear about, hoping. Because hope is painful. We need hope. Hope is really great to have kids continue to have, but hope is also painful when you expect it not to get met. It's one thing to hope to have a really yummy lunch today, and you go to a restaurant you like, and your hope is pretty darn realistic. It's another thing to hope to win the lottery just because you've bought a lottery ticket. You do hope. That lotteries are based on hope. But we sort of know it's not the most realistic hope. But, we'll just play with it. It's sort of a playful kind of hope. But if you really needed that lottery to pay off a loan shark who was going to kill you if you didn't give him $20,000, that hope becomes much more tangled and thorny because it's like you need it so much, and it feels so not long range. What's the word I want? Long shot. So, not rocket science, little kids ask questions with behavior. And so kids who have all these questions coming into adoptive homes ask questions with their behavior. This is not a plan. This is not conscious. They're not sitting there let's see. If I do this, then I'm asking this question. It's more like, I'm scared. I don't know what you're going to do next. And in that scaredness, I do this. And then I see what you do, but I didn't have that plan. It's just sort of, I'm using every opportunity with my behaviors to observe and figure out what's going on. So the questions aren't planned. The questions aren't indirect, or they're indirect because kids don't have the language, or they're too scared to ask it directly, even if they did have the language at 2 or 3 to ask a question in some basic way. A lot of times kids try to answer their own question. Are you safe? No. They may want to sort of ask a question of are you safe because they'd sort of like it to be a yes, but that's 1 chance in 100 that you're safe, so I won't ask it. And so it comes out sideways. Your answers, they can be in words, that's fine. It's sort of useless for the most part, except maybe your tone of voice. Your behavior is your answer. Don't rely on your words to be the answer. They ask the question in behavior, and they're really going to get the answer in your behavior. So what you do is so much more important than what you say. I would say it too. I'm not recommending to be mute. I would say it, and I would use a tone of voice that is trying to be in sync with your message, but it's really your behavior that is 95% of your response. And kids don't believe you the first time. They've got their own answer already from an abusive, neglectful home, and then whatever's gone on in terms of placements, and now they come to you. So they have an answer already that isn't usually the one you want them to have. So they're not learning it new with you. They are changing their expectation from what it already is. And that's important because a lot of adoptive parents feel like, well, I'll just show them and they'll get that. As if they came to you with a blank slate, but they don't. It would, unless it's, I adopted my daughter through Boys and Girls Aid Society. It wasn't through child welfare, it was from the hospital. So she came much more with a blank slate, although it still wasn't totally blank. But they come with all of these expectations already built in based on what they've experienced. And so you're trying to change their mind. It's a process. And so your answers need to be repeated over time and ideally be consistent. And it will feel like, I've done this 50 times and they still don't seem to get it because they're still going with their prior expectation. You want it to change, but it's so dangerous to stop believing that prior thing. It felt like that was for survival. And so it's really hard to let in the new information, especially if it's saying, yeah, you don't need to be scared here. You don't need to freak out. It's okay. Well, that feels like it's okay. I'm going to eat you in 5 minutes rather than 1 minute. It's just like, it's not very reassuring. Because to be reassured is to let your guard down and to put yourself at risk. Questions about this? Because this is yes.
Questions about reactive children that are having problems with reactive attachment disorder becoming parents.
Uh-huh.
And what that's like to be at the other end of that, trying to teach them to parent. And what are the odds of being able to look at our kids as they're going through the process of adoption, all that kind of stuff, and failure of adoption. How does that display? What does that look like? I'm asking a really big question.
I know. I'm trying to think about how to give you an answer that's not another 3-hour training. Yeah. The question is, when kids with reactive attachment disorder grow up.
And how do you spot them in this process so that you can help them before they become adults and have children?
It's the way to, and then there's a follow-up question about how do you spot them. I think I'm going to have to frustrate you mostly because I don't think I can answer you in any reasonable way without taking more time than we have, and because it's not directly on. It's a very important issue. People with reactive attachment disorder do grow up. They usually have a different diagnosis then, but they usually do have a diagnosis. Not always, depends on what's happened, but and when they become parents, it's a big issue because usually they're not well set up for it, and it's usually fairly triggering for them. It's not an emotionally numb experience. And so they do need a lot of help. Hopefully they're open to it. So coming back to the how safe are you, I wanted to sort of indicate the kinds of behaviors that will be asking this question. So things like provocative behavior, resisting receiving affection, not separating from siblings because the siblings are the ones that are going to keep them safe from you, nightmares, watching you, trying to be in control. All of those in various ways are related to, are you safe? I like the picture with the I love you because it's sort of like you're saying the I love you, but the kid is seeing the guy with the gun, superimposed over you. And that's what do you believe? Do you believe the words or do you believe that body posture and I believe the nonverbals there. So and you notice some of these behaviors occur for more than one question. So it can be hard to sort out what's actually getting asked. What are your patterns? So they may bring patterns with them that they try to get you to take on. They might, when they're first learning your patterns, want you to do it the same way every darn time. No, we don't have the spoon over there. The spoon has to go here because they want your patterns to be really predictable. In essence, to be rigid, because that will feel the safest. They may push against the routine, which seems contradictory, but if they push against it and it stays the same, then it's really true. If they push against it and it changes, oh, well, that isn't really a pattern then. That's just sort of a choice that's going to happen some days and not others. They can be really passive, like you want them to, they need a diaper change and they just go limp. Well, that's sort of like everything is you. I'm not going to do anything because I don't know what to do. You've got your pattern, but I don't really know it yet. So I'll just be really passive and sort of let you do whatever to my body because I don't want to piss you off. I just want to learn the right way to do this. And so, and conversely, they can try to be in control. They can try to do the pattern for you because they don't want you to go off script because that creates anxiety. And they can also try to impose that pattern onto other kids. That's another way to be in control, is that if another kid seems to be disrupting the pattern, they can become junior parent and like, nope, keep that pattern in place. Much more true of older kids, but even by 3, they will be trying to keep their 2-year-old or 1-year-old siblings in line to follow the pattern that they think you want them to do. What do I do to get what I need? Certainly, older kids tend to steal also. I don't see very many 2- and 3-year-olds that take stuff, but they will certainly hoard. If you count that as stealing, but they may try to be extra friendly or cute. It's usually one of the better ones. But screaming, hoarding, provocative behavior, and usually there's almost always parents that have other examples of the ways that kids work this, because there are 1,000,001 different strategies that kids use to try to, that they've learned in previous homes or that they're developing with you based on what you're unconsciously teaching them about what works with you. And then once I have it, how do I hold on to it? Have you spotted my badness? Basically, how do I stay under the radar and watch you to see whether you've spotted it? What will you do if I fall apart? And then what are all these feelings you're having? This big face is you with all your feelings sort of looming at them. And so some of the behaviors they may show with that is to try to block out your feelings. So you're feeling like as you're more loving, they retreat, they fuzz out. Can be one thing. They may attack, which feels really crummy. You come in and go, oh, sweetie, and they hit your face. It's like, if that doesn't kill the mood. You know, but for them, that moving in could be seen as a preparatory step for hitting them. It could be just the experience of, you're too much, get away. You know, it's not that they necessarily want to hurt you. It may be just trying to get some space, some distance. And then they may try to control you to manage your feelings, to get that space, to regulate how much intensity is there. So the kids, despite all this provocation and difficult behaviors, they want connection. They may not want it, how would I put it? They want it to be there at some point in the future, but they may not want it right now with you. And there's a subtle difference between those two. One is about sort of, well, to use an adult example, you know, somebody may, yeah, I want to be married in the future. I might even think about being married to you in the future. But if you ask me right now, I'm going to say no. Because, I mean, it's only the second date, and that's too weird. And it's an example just sort of about pacing. You know, most people don't want to get asked to get married on the second date. And kids don't necessarily want, on their second contact with you, to feel like you're the love of their life and, you know, we're going to be together forever. So there's some of that pacing there. So, questions? I'm going to start shifting into about how you can respond. But before we get there, I want to just see if there's questions about these behaviors. And
Well, on the, have you spotted my badness yet? Sometimes you observe when, like, when a foster parent is becoming the adopted parent, a kind of escalation of behavior, which you almost thought was like putting the badness on display. Like, hey, here it is. Do you see it now? Are you sure about this? Is that also something? Are we interpreting that possibly correctly?
possibly, but I think there's always multiple possible explanations. It's one of the challenges. Because the question was, when a child's in a foster home and that foster home is transitioning to being an adoptive home and the feelings are changing, they may see an increase in the behavior and a more provocative behavior. And one explanation is, well, I'm putting it all on display. Another possible explanation is that it's making them really anxious. That they're feeling that shift in the feelings, they're feeling the sort of deeper love, if you will, and they're having feelings in response, but the stakes then are getting higher because they may still expect that this is going to end. And they don't maybe get that that increase in closeness and deep feelings is a preparation to have permanency. It may just feel like, uh-oh, they're like, they got these feelings and now I have these feelings, but I'm still going to leave. And now it's going to be so much worse. And what does it mean? You know, what is the feelings mean, but also how can I possibly survive this? So it could be just dysregulation out of the anxiety that they can't hold it together as well. It could also mean, and this is more true of older, more toddler or older, that they don't believe it. And they know that you're going to get rid of them, and you're confusing them with this behavior that seems to be about keeping them. So they're going to just get you to get rid of them, because it's not okay to be feeling closer to you when you're getting rid of me. So I got to get out of this. Yes?
With older children, does that sometimes become a point where it sort of dashes all of their hopes of going back to their parents?
Yes, she's making a good point that another possible piece is that it may also be about giving up hope of returning to a birth home, and that may bring up a lot of feelings. You're right that that's probably more true for older kids. It depends how much contact there is with birth parents at that point in the process. Sometimes that transition is happening and rights aren't terminated yet. There may still be visits. And so for younger kids, once visits with a birth parent stops because rights are terminated or whatever, or the parent's gone to jail or is not findable, that starts to convince them over time, even though they still have that loss, but they have less hope. And so it seemed like there was another, yes.
So that's kind of the point we're at with my son, and it's really hard for me because we started out just as foster parent, and we have to keep that open mental mind of, we have to support whatever plan the department wants.
Uh-huh.
And I think at this point it's pretty certain that we're going to be able to go through with this, but I always hesitate to start talking to him about it. I mean, in his mind, we're his parents, because I've had him since he was 12 months old. But like the fact that he's not going to be visiting his biological parents on a regular basis anymore. I don't know how to start talking about that, when to start talking about it, especially since he's only 3 and his idea of future and permanence is still so fragile.
Uh-huh.
And and then there's in the back of my mind the fact that, lightning's going to strike twice and he's going to go somewhere else.
Uh-huh.
So how do we as a family navigate that process?
Well, I think a lot of it is, I think that last comment was very telling. The question was, for a 3-year-old who's moving towards an adoptive status within this foster home, how do you talk about it? How much lead time do you give? And a lot of it is about what is going on inside the adults. Because practically things aren't changing in terms of where, assuming it all works out, none of the practicalities change. It's the emotions that change.
Right.
And so it's about when you can trust yourself to allow yourself to have the degree of openness or expansiveness with your loving, and trust that the lightning isn't going to hit you. And that's just this process that happens, and some people are more trusting than others in the system and what's happened. Some people wait until, birth parents' rights are terminated and we know they're gone, and some wait even longer than that until it really feels like the system isn't going to all of a sudden discover a relative over here that, there's various pieces that can introduce scared feelings. The biggest change practically for him will be the stopping of the visits.
Right, and that's kind of what I'm working on my own process emotionally. He's not really involved with that.
Well, he is in that he'll be reacting to it all along the way, but yes. In terms of the visits, it's it's not useful to say they're going to stop in a month or to have a time frame. If there is a definite piece, if there can be a countdown, like you've got a piece of paper and there's 4, 3, 2. So I wanted to talk some about what you can do. And the first thing is what we've been doing sort of today, and we're talking, was to really try to the extent you can to be out of your perspective and into the child's perspective. And especially keeping in mind the child's developmental status and the way they think about the world, the way they experience relationships. That's crucial regardless of the age, but I think it's especially important in birth to 3 because I think it's harder for us to get it from a 1-year-old's perspective than a 10-year-old's. It's a bigger leap for us. I think a thoughtfully available stance, and I'll say more about what that is important. To be responsive, not reactive to provocation, and to have predictable but not rigid structure. So a thoughtfully available stance is similar to what Man was saying earlier about being able to be present but watchful, looking for the child's cues, sending signals that you're interested but not overwhelming the child. That's why I like that, why I chose that picture. Because the adult's hand is just, it's there. It's open, it's available, but it's not, the little kid is the one who's saying, okay, I'll grab that finger. And so the little kid has some control over the contact. The contact is available, but the little kid is a partner in that contact being made. And so it's looking at how you can send signals that you're available, but in a way that indicates the child will have some ability to manage the intensity and the level of contact that's going on. And that you follow then in a back and forth process what the cues are for the kid. Even if it's going really well, the kid will need breathers, breaks. You see that just in any sort of just play between an 8-month-old and a really good birth parent. And there's all this wonderful play back and forth, and then the kid will look away. And then they'll come back and they'll want more. And that looking away is their own regulation. It's their own ability to sort of say, this is a little much. I need a little breather. I need about 5 seconds of just not being in this. And then I can come back and do another 30 seconds of it. So it's having that thoughtfully available stance is really important. It communicates that you're available and interested, that you notice the kid's feelings and you're paying attention to them, that you prioritize their feelings over yours, that you may want a lot of contact, but you're going to wait and see how much they want, and that you'll respect their feelings over time, and that a no of my hand's out here, but you don't want to grab it right now, that's okay, that's fine. So a no is okay, that they don't take you up on the opportunity. That's my daughter at age 10, and that expression on her face seems to me to be about, so what's up with you, Dad? I feel like she's doing this sort of checking out the thoughtfully available, and I think she's going to say no for that particular interaction. So some examples for little kids would be like sitting on the floor, they're playing with something, and you come and sit down, but you don't come and sit down necessarily right next to them and start to play with the toys. You sit a little ways away. I said 3 feet, and you wait for the kid to send you an invitation to join. And that invitation could be looking at them holding up something to you. It's watching for a sign that, yeah, I'm busy with this, but I want you to. And then you join. It can be you're playing with a toy and a kid comes in, and instead of like, hey, come on over, sit down, let's do this, you just like take a toy and, I'll put it over here. And the kid can just watch, and then you continue playing, and the kid can watch for another 3 minutes if they want, and not join in immediately. Or they could come over and pick up the toy that you put out there and just sort of look at it and watch you. Or they could come all the way over and join in fully with you. It's a way of indicating when you put the toy out there, that's an offering, but it's not a demand. It's a lot of possibilities there. The kid could just look at you and walk away. You could sit on the couch, and if the kid's on a couch watching TV or something, or some screen activity, although at birth to 3, I don't really recommend that. American Academy of Pediatrics doesn't recommend it, but it might still happen occasionally when you're trying to get dinner done. But the kid's on the couch, and so you sit down next to them, but you don't necessarily start interacting right away. You might just put your hand out. Or you might say something about what's going on that you all are looking at. And the kid could respond or not respond. This is really useful for little kids that are just crawling. You could lay on your back on the floor and then just pat your tummy. I have a good tummy for patting. You could pat your tummy. And that's a signal that, hey, I'm here. My body is here. I'm actually might be lower than you. And you could crawl on me or not. You could pat my tummy or not. You're available for their kind of behavior, but they could just ignore you. It sort of hurts a little when they ignore you, but you have to be willing to put up with that. Yes?
I have a question about a 15-month-old and these visitations that started with a relative. And I observe those visits as a CASA, and this relative is in this baby's face continually. The child screams continually.
Sounds very unpleasant.
So as a CASA, I can only say so much. But how could I say to her, give this child some space? It's heartbreaking.
Yeah. I mean, I guess I wonder, I know some of the places have therapeutic visitation where,
It needs to be.
yeah. So, I mean, I might try to see that because I wonder whether the birth parent's going to be able to take in your advice.
I don't think so.
Is there anybody else, a caseworker? Or?
In the beginning, the caseworker, but now it's in a visit house.
Okay. I mean, I guess I just see if there's any way that somebody else could model without necessarily redirecting the parent directly unless they have a relationship. If that parent has their own therapist or something that could be present. But if just anybody could model a more regulated way of interacting with the infant that the parent could watch for a bit without sort of beating them over the head that you're doing this wrong and here's the right way, but just trying to show some examples that the infant might respond better to and maybe they would get a clue.
Maybe. Thank you.
So the responsive, not reactive, is in response to the child acting provocatively, is that it's really tempting to do something right away to a child's provocative behavior, and certainly you have to for safety issues. but it can be useful to take a breath and think about it, and that in essence there's sort of to be the good cop, to have the rules, but also be interested in the welfare. And I had one parent ask me once, well, if you're the good cop, who's the bad cop? And I said, well, the bad cop is inside the kid. The bad cop, the kid is giving themselves all sorts of negative messages. We don't really need another bad cop around. We need a good cop that has rules, but also has can communicate their desire around the welfare of the person, and it's not just about the adult's angry feelings. It's hard because usually the kid's having a lot of feelings, and as humans, a lot of negative feelings, and as humans, we tend to be wired to respond in kind, unfortunately. It's really, I think, a little bit of a design flaw that should get worked out in the next iteration of evolution, that we don't automatically respond with the same feeling. It works really well with love. You know, you get love coming to you and we respond with love. That works great, but this whole thing where anger is responded to with anger, there's lots of ways in this world that doesn't work so well. And then the child's experience of structure. That structure is so lovely for kids, and for little kids especially, because they can learn it, but it so helps them feel safe, and it feels like they can know what to do next because they've learned the structure. Nobody's taking control away from them because it's just the routine. It's not you choosing something, it's just you doing the same old thing. And it's really not, routines are safer than people for little kids, especially kids who've been through maltreatment, because a routine is something that has proven itself safe over time. People feel much more unpredictable and scarier than a routine. And so, you know, I see kids all the time where there'll be a new caregiver who's informed about what the routine is, and they start the routine, and the kid just settles so much compared to how that, because the new caregivers, the kid doesn't know, but if they show that they know the routine, that is so cool, because it's as if they've got a stamp of approval from the other caregiver in that, okay, we're doing bath time and it looks the same as it did before. We're doing meal time and it's, you know, the same Cheerios on the same tray, and it's all consistent. Oops. And then just a reminder that, again, it's all unique. So every kid is different. Everything I've said can be partially right, partially wrong, totally wrong for any particular kid. So I just undid everything I've said, but that's really important. We have about 5 minutes for questions about anything I was covering today.
I have a comment. I've in working with families that have children that they're really struggling with parenting, and because of some of these issues, I found kind of the 3 options parenting works really well. And that's just giving kids 3 options, and all 3 options you're happy with, and there's only one that the child is happy with. And they always will pick that one and then feel like they won. Right? And
Yeah.
so and that's kind of with regards to your last slide of having control and feeling like I have a voice in this family, and I'm given options, and so it seems to work really well.
Yeah. So please fill out your evaluation forms. I meant to put in a plug for that at the beginning because I really find it valuable to hear your feedback. If you also did a survey, then you can leave both of those out on the tables in the back. There are certificates of attendance if you're just doing that out when you leave. So it's not a piece of paper you get. And then there's also, if you signed up for CEUs, you can take care of that at the end too. So thank you very much. Really appreciated your questions. Thank you.